Hello, this is Dabrow Woods, Chief Nurse of Walters Clover Health Learning Research and Practice, and we are in the last week of Nurses Month. As you know, the ANA designated this month to be Nurses Month, and throughout this time we've been talking about their main theme, A Voice to Lead, Nursing the World to Health. And each week we focus on several different concepts. In week 1, we looked at self-care and the importance of taking care of ourselves so we can care for others. Week 2, we talked about the importance of recognition. And in this day of COVID-19, it's not only about recognizing those in critical care and in hospitals, it's recognizing all the other nurses who are doing everything they can to support the work of people on the front lines, but also caring for people in long-term care, rehab, and in home care. In week 3, we looked at the importance of professional development and recognizing that we are on a lifelong journey looking at education and learning more and more as we go so that we can provide the best care to our patients. And this is week 4, and this week we're going to talk about the importance of community engagement. That's right, we need to go back and take a look at the importance of our community in the care that hospitals deliver. No more is it taking care of one patient at a time. It's really looking at caring for the whole community, because only then can you really make a difference in people's lives. Today we know healthcare, when we look at the amount of dollars that are spent, the majority of dollars that are spent are in acute care, and we need to flip that scenario. So we put the majority of dollars that are spent in the community and primary care to keep people out of the hospital and get them on a path to wellness. And in order to do this, we need to take a look at the social determinants of health. HealthyPeople.gov has coordinated all the social determinants of health under 5 key areas. The first one is neighborhood and built environment, meaning do the patients and does the community have housing security? The next one is health and healthcare. Does the community and all the people within it have access to primary care? And do they have the opportunity to get screening and health prevention? The next one is social and community context. Does the community have adequate resources in order to care for every member within the community setting? The next one is education. Do the people living within that community have access to primary and secondary schooling? What percentage of the community has actually completed high school or received their GED? And what is their health literacy? And the next one is economic stability. What is the financial situation of the people within the community? Why is this important? Well, we need to ask ourselves, if a primary care provider writes a prescription, will that patient even be able to afford that prescription at all? Or will they make the choice to go without food in order to fill that prescription? We all know that food is a basic need. So the bottom line is the patient's not going to fill that prescription if they can't afford it. So social determinants of health are a key driver in what we do as nurses, and we need to pay really particular attention to it. We have that ability to develop that trust with our patients, and they may tell us things that they are not willing to tell other people. So we need to make sure that each and every time we have an interaction with a patient, that we ascertain whether anything has changed in their environment or within their life. And as healthcare organizations, we need to be equally embedded within the community as we are with taking care of one patient at a time. And as nurses, we need to celebrate the fact that we are making a difference, one person and one community at a time, in order to improve patient outcomes. Thank you very much.